So in endocrine pharmacology, we are going to start with oral hypoglycemic agents. Particularly in this video, we are going to discuss about sulfonylurea. What is its mechanism of actions? So it's anti-diabetic medicines which are used in the management of diabetes mellitus. So what actually sulfonylureas? If we talk about the classifications of sulfonylurea, these are the drugs. Sulfonylurea, well-known drugs. So there are a first generations and second generation drug. In first generation, the drug is tall butamide propamide, you can check the spelling. Then second generation is glimepiride. These are the drugs which are being used. So what is the difference between primary generations and secondary generation of sulfonylurea? Primary generations, secondary generations are more potent as compared to primary generations. So what is the meaning of more potent? More potent means less dose is required to achieve the therapeutic effect. In this case, you need more dose, right? So if you are using more dose, so obviously it could result in more adverse drug reactions. So when you are using less dose, because these are the drug glimepiride, these are effective at low doses. So obviously they are less, they are associated with less adverse drug reactions as compared to primary generations, right? They have a less drug-drug interactions as compared to primary generations. So primary generations and secondary generations. So now currently we are using secondary generation drugs, but in some cases if secondary generations are not suitable, then we are using the primary generations. So we are going to talk about what is its mechanism of action. That is very important to understand how these drugs reduce the blood glucose levels. So you all knows in earlier videos also we have discussed about how glucose maintenance is done, how glucose level is maintained, right? How blood glucose level is maintained. So how blood glucose level is maintained? You all knows there is in pancreatic cells. In pancreas, there are your cells, different types of cells are there in the pancreas. One is your beta cells, right? There are your alpha cells, there are your delta cells as well, right? So if you see these cells, how these are arranged in the pancreas, so mainly beta cells are in the center. Beta cells are in centers. These are surrounded by your alpha cells. Alpha cells, for example, these are your beta cells in the islet of Langria, right? Then these are your alpha cells, and delta cells are everywhere. Delta cells are everywhere in center as well as the outside. So these are your delta cells, right? So when we are going to take this beta cells, because we are going to understand how blood glucose level is maintained by the beta cells, which going to synthesize and release very important hormone, that is insulin. So again I am repeating, so if you see the islet of Langria, you will in the pancreas you will find that there are a beta cells are in centers, these are surrounded by the alpha cells, and there is a delta cells which are everywhere, right? So we are going to talk about how these, I am just taking one cells, this is your beta cells, right? This is your beta cells. So what beta cell is doing. So particularly first you have to understand beta cells synthesize and store the insulin, right? Beta cells in the vesicles, it stored the hormone, and that hormone is insulin. This is your insulin, right? So now you have to understand how this insulin is released whenever there is a stimulus. So what is the stimulus to release this hormone which is stored inside the vesicle? The stimulus is glucose, right? So whenever you take lot of food or some sweets, so in that cases your blood glucose level is much more. So in these cases these cells will sense it that blood glucose level is more. So, they are going to release one hormone, that hormone is insulin. So, how it is going to release from the beta cells? So, how it is going to release? So, you know, there are receptors for the glucose, or sorry, I can say that these are the channels for the glucose. So, channel for the glucose is, we call it GLUT2, glucose transporters. GLUT2, these are the transporters for the glucose molecules. So, glucose will enter inside the cells, right. So, when glucose enter inside a cell, and these channels are in bidirectional, means glucose can move from inside to outside and can move from outside to inside. This is your extracellular fluid outside the cells, right. So, glucose enter through these GLUT transporters, and inside the cells there is the enzymes glucose kinase. So, this will convert this glucose into glucose 6-phosphate, right. This glucose 6-phosphate through the process of glycolysis convert into pyruvic acids. Pyruvic acid is going to enter into the TCA cycles, or you can call it Krebs cycles. And during these cycles, what will happen? Your ADPs are converting into ATP, adenosine triphosphates, and these ATP which are formed, there are channels here which are potassium channels, which are ATP sensitive potassium channel. These are ATP sensitive. So, when there is a ATP, so these potassium channel is going to close. This is very important to understand when we talk about mechanism of sulfonylurea. Again, I am repeating. See how this insulin is going to release. First, we are going to understand it, which is stored inside the pancreas. So, there should be stimulus which will release this insulin, which is stored inside the vesicles in the beta cells of the pancreas, right. So, what is the stimulus? Stimulus is your glucose. So, glucose is going to enter inside the cells, and how it enter inside the cells? With the help of one transporter, and that transporter name is GLUT2. Why 2? Because it can move from outside to inside, inside to outside, if it remain glucose molecules, but it is going to convert into glucose 6-phosphate, and glucose 6-phosphate molecule is not going to move from inside to outside, but glucose can move. So, there is an enzyme glucose kinase which will convert this glucose into glucose 6-phosphate. Glucose 6-phosphate is undergo the process of glycolysis and do the formation of pyruvic acid, and pyruvic acid is going to enter into your Krebs cycles, that you also call TCA cycles, and going to do the formations of ATP. And this ATP, when there is a ATP generation is more, it is going to block one channels, very important channels, that is your potassium channels. What there is an important concept which you have to understand is, normally when there is no stimulus, when there is no glucose, when there is no stimulus, so what happens? This potassium channel is open, right. So, when potassium channel is open, so many times we have discussed which ions inside the cell is more. For example, this is intracellular fluid inside the cells, this is your extracellular fluid. So, inside the cell which ions are more? Inside the cells your potassium is more, right. Your phosphate ions are more. Outside the cell in extracellular fluid, which ions are more? Sodium is more, chloride is more, right. So, in normal conditions, when there is no stimulus here is glucose. So, what happen in that normal conditions? Your potassium channel is open. So, when potassium channel is open, so in which direction potassium ions will move? Potassium will move from intracellular to extracellular. Why? Because in normal conditions inside the cell potassium ions are more. So whenever these ion channels are open, so potassium is going to move from inside to outside. So potassium is going to move in normal conditions. There is a potassium channels, so your potassium is going to move from inside to outside, and it's maintaining your resting membrane potential, that is your minus 70 millivolt, right? Because positive ions are moving from inside to outside, so your action potential will towards the negative side, right? So that will be called resting membrane potential. So what happens when there is a stimulus and this cycle is going to be done, and there is a ATP, and these channels are ATP sensitive. So this ATP is going to block these potassium channels. So when their potassium channel block, so what happens? Your potassium will not move from inside to outside, right? So when your potassium is not moving from inside to outside, this action potential will become little bit less negative. For example, it becomes minus 60 millivolt, then it becomes minus 50 millivolt. So your action potential is going to become less negative. And when your action potential is going to become less negative and reaches little bit threshold, so what will happen? So when this action potential, many times we have discussed, when it reaches to threshold point, for example minus 50 millivolt, here is minus 70, when it reaches to the threshold point, so what will happen? There is a voltage sensitive calcium channels, so they are going to open. Voltage sensitive, again the word it mentions, these are the ion channels which will open when your action potential reach to threshold. So when your action potential reach to threshold, what will happen? Your calcium channel is going to open. So calciums will enter inside the cells. So when your calcium is entering inside the cells, so what will happen? Your action potential will go towards the positive sides, and it result in a phenomena, that phenomena we have many times discussed, that the depolarizations. It will depolarize the membrane. So these calciums, increased calcium levels inside the cells is going to diffuse these vesicles with the membrane, and when it diffuse with the membrane, so the chemical which is stored inside the vesicles, and that will be come out, and that chemical is insulin, right, which is required to do the uptake of glucose inside the cells and maintain your blood glucose levels, right? So by understanding this mechanism, now you can simply understand the mechanism of sulfonylurea, that is your oral hypoglycemic agents, the drugs which we are using as anti-diabetic medications. So that drugs, what that drugs are doing, that drugs are working here. These drugs are working here. What these drugs are going to do? These drugs are going to block your potassium sensitive channels. So sulfonylurea, drug like tolbutamide, chloropropamide, glimepiride, these are going to block your potassium channels. And you know that if potassium channel is blocked, so your action potential is going to become less negative, and once it reaches the threshold, your voltage gated sensitive calcium channel is going to open, and when your voltage gated sensitive calcium channel open, more influx of calcium ion inside the cells, and it results in the depolarizations. It will do the vesicles fuse with the membrane and release the chemical which is stored inside the vesicle, and chemical is insulin. So insulin will be released more. So you want to release the insulin, right, to manage the diabetic patients. So sulfonyl is the drugs which is going to block. There is a meglitinide is also there, class of the drug, rapaglinide, nataglinide. These are the drugs also interfering here, right? So this is all about mechanism of actions of sulfonylurea. Again, to understand the sulfonylurea mechanism, सबसे पहले आपको ये समझने की ज़रूरत है कि जो इंसुलिन स्टोर्ड है हमारे पैनक्रिएटिक बीटा सेल में, कहाँ पे स्टोर है? पैनक्रिएटिक बीटा सेल में। वो रिलीज़ कैसे होता है? रिलीज़ कैसे होगा? ऐसे तो रिलीज़ नहीं होगा इंसुलिन। जब उसको स्टिमुलस मिलेगा, स्टिमुलस क्या है इंसुलिन को रिलीज़ होने के लिए? ब्लड ग्लूकोज। जब आपने मीठा खाया, खाना खाया, उस टाइम पे आपका ब्लड ग्लूकोज लेवल बढ़ा, तो वो ग्लूकोज लेवल जब बीटा सेल्स में एंटर करेगा, तो उसको एंटर करने के लिए चैनल हैं जिनका नाम है GLUT2, ग्लूकोज ट्रांसपोर्टर 2। वो क्या करेंगे? ग्लूकोज को सेल के अंदर लेके आएंगे, ग्लूकोज काइनेजेस उसको कन्वर्ट कर देंगे ग्लूकोज 6 फॉस्फेट। ग्लाइकोलाइसिस में वो कन्वर्ट हो जाएगा पाइवरिक एसिड, पाइवरिक एसिड आपका एंटर करेगा टीसीए साइकिल और क्रेब्स साइकिल में। क्रेब्स साइकिल अगर आप सही से देखोगे, आपने प्लस 2 में भी पढ़ी होगी, देयर इज ए फॉर्मेशन ऑफ लॉट ऑफ एटीपी मॉलिक्यूल फ्रॉम द एडीपी। These ATP molecule, there is a on the membrane there is a ATP sensitive potassium channel. So these are the channels which are sensitive to ATP, right? These are the channels which are sensitive to ATP. So these ATP will block these potassium. So block the when you are जब आप पोटासियम की चैनल को ब्लॉक कर दोगे तो क्या होगा, पोटासियम चैनल आपने ब्लॉक कर दिया तो पॉजिटिव आयंस अंदर से बाहर नहीं जा रहे, अंदर से बाहर नहीं जा रहे, तो एक्शन पोटेंशियल जो आपका नॉर्मल -70 मिली वोल्ट जो कि आपका मेंटेन था वो क्या होगा, थोड़ा सा कम नेगेटिव हो जाएगा क्योंकि आपके पॉजिटिव बाहर नहीं जा रहे। तो आपका एक्शन पोटेंशियल जब थोड़ा सा नेगेटिव हुआ, -60 हुआ, -50 तक हुआ, तो उसके बाद क्या होगा, आपके कुछ चैनल हैं जो कि सेंसिटिव हैं वोल्टेज के। तो जब आपकी वोल्टेज, जब आपका एक्शन पोटेंशियल थोड़ा सा आपका कम हुआ तो उस केस में आपके वो चैनल ओपन हो जाएंगे। कैल्शियम वोल्टेज सेंसिटिव कैल्शियम चैनल, इसलिए हम उनको बोलते हैं। तो उस केस में क्या होगा, कैल्शियम बाहर से अंदर ज़्यादा आएगा, कैल्शियम बाहर से अंदर ज़्यादा आ जाएगा तो वो वेसिकल को डिफ्यूज करवा देगा, वेसिकल से जो केमिकल स्टोर है वो रिलीज हो जाएगा। और केमिकल क्या है, इंसुलिन, राइट। और इंसुलिन क्या कर रहा है, इंसुलिन जब ब्लड सर्कुलेशन में आएगा वो ग्लूकोज की अपटेक करवा देगा सेल्स टिश्यूज में, तो आपका ब्लड ग्लूकोज मेंटेन हो जाएगा। तो इस केस में क्या है, कुछ ड्रग्स हैं हमारी जो कि क्या करती हैं, पोटासियम चैनल को ब्लॉक कर देती हैं। पोटासियम चैनल को ब्लॉक करेंगी तो अगेन एक्शन पोटेंशियल आपका बढ़ेगा तो कैल्शियम ओपन हो जाएंगे, कैल्शियम ओपन हो जाएंगे, आपका इंसुलिन रिलीज हो जाएगा। और आप चाहते हो कि इंसुलिन आपका रिलीज हो सो दैट टू मेंटेन द ब्लड ग्लूकोज लेवल्स। नॉर्मली पोटासियम ओपन होता है, पोटासियम ओपन होता है तो मैंने आपको बताया पोटासियम जब भी ओपन होता है तो अंदर से बाहर की तरफ मूवमेंट होती है। क्यों होती है, क्योंकि नॉर्मल कंडीशंस में पोटासियम की कंसंट्रेशन सेल के अंदर ज़्यादा है, तो ये पोटासियम बाहर निकलेगा तो और आपका रेस्टिंग मेम्ब्रेन पोटेंशियल मेंटेन रहता है -70 मिलीवोल्ट। सो दिस इज ऑल अबाउट योर सल्फोनामाइड, जो कि वो ड्रग्स हैं जो कि इसको ब्लॉक कर देंगी तो वो जल्दी आपके इंसुलिन को रिलीज करवाएंगी, राइट। सो दिस इज ऑल अबाउट योर सल्फोनामाइड ड्रग्स। और मैग्लिटिनाइड is another class in the anti-diabetic medicines, rapaglinide, nataglinide. Thank you. In next video we are going to discuss about mechanism of other anti-diabetic medications. Thank you.